here's something we hope you'll really like.
Okay, so thanks for tuning into our podcast. I'm Dr. Matthew Plant from Toronto, and I am here with
Dr. Giancarlo from Miami, Florida.
So we decided we wanted to start a podcast because we really just didn't think that there was anything out there for the people that we feel we speak to, which is people who just want kind of the real deal about plastic surgery, no kind of like old white guy preaching to them, no sort of like young, slick salesman trying to sell them procedures they don't need. Just two guys who really have no appetite for BS and really just love to give the real deal to people.
I think that's a great description. Keeping it real.
That's right. Keeping it real. But, you know, not the trademark, keeping it real like Dr. Miami.
Is that his trademark? It's a pretty good one.
I have no idea.
Get our lawyers on the phone. We need to trademark that.
That's right. That'll be the next episode. Intellectual property.
But Dr. Plant was about to do was introduce himself and how we know each other. And we actually go way back. A lot of people don't realize how tough and long surgical residency. It's like a war, being at war. So Dr. Plant is my war buddy. And really tough times create diamonds. And so Dr. Plant's going to introduce himself now, and then I'll follow.
All right. So I guess I'll give you sort of my standard bio. So I did my medical school at the University of Western Ontario in London. And then I made my way a couple hours up the road back to Toronto for residency. And that's where I spent about 6 years or so working alongside Dr. Giancarlo and a bunch of other people, and you know, learning our skills and basically having the tar beaten out of us by our supervisors, and just sort of making us, let's say, thick-skinned.
It's a good expression. So, you know, I was born in Canada. My dad is Colombian immigrant. My mom is Canadian. I did all my schooling in Toronto up until university. And then I went to the Caribbean for medical school. So a little bit nicer weather than London, Ontario for Dr. Plant. And then Dr. Plant and I actually met at the University of Toronto, which is a very, I call it the Harvard of Canada. Maybe I'm biased because I went there, but I think it is. It was an excellent school, excellent training program, but it was tough. Our supervisors, if they're watching, we love you, but you guys are tough. And I was there for about 6 years or so as well. And I went and practiced for 2 years at the McLean Clinic in Mississauga afterwards, doing a lot of transgender surgery with the excellent, world-renowned Dr. McLean. And then an opportunity arose to do a more digital, online kind of practice in Miami, Florida. And so I took the opportunity, and here I am.
All right, you tell your story way better than I do.
Well, you know, I've been doing these Instagram lives every week now, and I feel like now the flow and the comfort on recording is so much better. The first few weeks I was like, and now it's just like, just going with it.
Well, it definitely shows. So why don't we talk a little bit about, you know, what exactly made our lives so hard in residency before we start kind of telling people all about procedures. Why don't we give them a little background on us so they understand why they should actually listen to us. So I don't know, what's kind of the worst thing that you remember being done to you as a resident or a med student by a staff person? Let's start there.
Well, I mean, there's like some like bad memories, and there's some good memories, and there's some things in between. But I think one of the worst things that ever happens was once as a medical student, and this is like a sensitive story, but I'm going to tell it because whatever, is I was a medical student working in an unnamed med-surg ICU, you know, working my guts off because I wanted to be a plastic surgeon. So people may also not know this, but plastic surgery is a very competitive specialty. So they only take the best medical students. So at this time, I was like staying up 30 hours, and you're a medical student. So you're reading, you're studying, and you're trying to be your best ever. And I had been up, for maybe 30 hours. And in the morning you have to do rounds. And so we were doing rounds, and one of the staff was asking questions. It's called pimping. For people who don't know, it's where the staff members and the older residents try and, show off their knowledge a little bit by asking you questions that you probably don't know the answer to. So anyway, we were all exhausted, and this one staff was doing the rounds, and we were doing maybe an hour of this pimping. And, at the end of a long shift, it was just getting really tough. So I literally fell asleep standing up and hit the wall and made a noise. So, like you doze off and you kind of like this, but I hit the wall. So I made a noise. You could hear a pin drop. Everyone looked at me, and I just looked at everyone. I was like, sorry, sir. Like, I don't know what happened. I'm sorry. And he lost his cool on me. Like, he kind of was like, if you don't want to be here, you don't need to be here. If you don't want to work, and I'm like, no, sir. Yes, sir. No, sir. Yes, sir. Just like trying to weather the storm. And then after, he actually apologized to me, but I've never taken a beating like that. And I can tell you from the bottom of my heart, I was working harder than I've ever worked before or after. And to get berated like that, it was crushing, soul destroying. So I think that was my worst story. And I think from that experience, I just learned, number one, I would never do that to anyone. I treat my med students like gold, my residents like gold. If someone's tired, I send them home because I know people are working hard. So it kind of taught me a lesson on how not to behave.
Yeah, no kidding. When it comes to crazy stuff, surgeons definitely know how to destroy your entire psyche in 2 minutes or less. Yeah, it's just one of those talents.
I think because go ahead. You're going to say.
No, you go.
I think just to finish on your point is because we care so much and we're putting our heart and soul into this. So it's actually not that hard to destroy someone. You actually have to be very careful of what you say to a medical student or a trainee because they're so sensitive because everything matters. Do you know what I mean?
Yeah, absolutely. Especially going for a competitive specialty like plastics or something, literally anything that anybody reprimands you for, you're like, uh-oh, there goes my residency.
There goes my life.
I'm going to be a proctologist.
They're going to kick me out of med school. Who knows?
Right.
Your life flashes before your eyes for the simplest infraction. But the reality is everyone makes mistakes. No one is perfect. So it's a tough situation to be in.
Yeah. And I mean, honestly, it's better to make those mistakes as a resident than it is, once you're a staff and there's no one to kind of let you know you've made a mistake before something shows up as a complication.
100%.
So I guess I might as well share my sort of worst story during med school and residency. So it happened when I was a third-year med student. I was a clerk on general surgery, and I remember it was about 3 a.m, and we were dealing with this bowel, I think rupture actually. And we did the full open procedure. The patient was open from sternum all the way down to their pubic bone.
Oh my gosh.
And I'm there, I'm, basically water skiing, which is what we call people who get to hold a retractor and just hold it for an hour and not move. And if you move, you
can't even see what's going on.
Yeah, you just hold on to this retractor and do not move it so that your staff does not notice you. So I think after about probably 75 minutes or so of holding this thing, my hands were numb, my feet were killing, my back was about to go out. And I think it moved, I don't know, maybe a millimeter or so. So he decided to give me a different job because clearly I sucked at that one. He handed me a metal tray, just, for putting objects in, told me to hold it really close to my stomach. Oh yeah, you know where this is going. And yeah, so I got to hold this metal tray, and you can kind of picture me like a human basketball net, the tray is the hoop, my chest is the backboard. And and so when he got into the problem area where all of the fecal matter had escaped the bowels into the belly, and he started pulling these pieces of poop out, they needed to go somewhere. So he decided to toss them into this receptacle and use my chest as an actual backboard when doing that.
That's so bad.
Yep. Just like the monkeys exhibit at the zoo.
Did he shout Kobe before throwing things at you?
He just gave me this look and then silence. most scared I've ever been.
But I think that is like a horrible story. It almost makes mine seem benign. But I think, it's just going to highlight the difference between kind of old school medicine, old school surgery, and kind of new school. We're the new school. And the old school, unfortunately, was a very cold, mean place where there is no weakness. There is no work-life balance. There is no feelings. You're there like as almost like a slave type situation, because they went through that. So they think that's the way it needs to be for their trainees. It's kind of a sad situation, because I would never treat a student like that, or another kind of trainee. It's awful.
Yeah.
No, but we got to go to positive stuff now. Let's do a positive story. It's like, this podcast is a downer, man.
Yeah. That's right. Well, I suspect people listening are still laughing at us a little bit. Maybe downer for us.
How about, let's do it. What's the best memory, or what's the best thing you did as a trainee or a medical student, or best, I don't know, uplifting?
Uplifting. You want to take this one first, maybe, while I think about it?
Yeah, I have a lot, actually. And that was the nice thing about plastic surgery and being a surgeon, is you help a lot of people. And there's a lot of beautiful stories on the way. But I think the most famous one that I was involved with as a very small, cog in the machine, was I was able to assist during the first hand transplant at Toronto Western. And this was, this story's all in the news. It was a nurse who had a rollover car accident and lost one of her arms from the elbow down. And with a 24 operation and 8 surgeons working around the clock for a full 30 hours, we reattached her hand, and now it's fully functional. And I just remember being a part of that. I felt like being on the World Series team as the bat boy. But it was still amazing, because your hand, you're still a part of the team as the smallest role. And it just felt
you still get the ring.
Yeah, you still get the ring. And it just felt so special to be a part of something so meaningful, impactful. And the fact that it was a first time in Canada was even more Blue Jays World Series. So I think that kind of made all the tough times that you go through worth it,
Yeah. Yeah, I actually totally remember when that happened, seeing it on your social media and stuff.
It was unbelievable.
Cool. So I guess for me, probably the story that sticks out as positive was when I was working at one of the major trauma centers, and this young guy, probably in his early 20s, came in, and he had been in a fight with his girlfriend and decided that things were bad enough that he wanted to take his own life. And he actually took a shotgun, put it under his chin, and pulled the trigger, and did actually attempt to kill himself. Unfortunately, it's kind of a well-known mechanism in plastic surgery that it's basically impossible to actually kill yourself with a shotgun, just because the way the angles work out, it's always just pointing straight up. So it ends up severely damaging your face and not actually injuring much brain tissue, which leaves you alive and very disfigured and very in pain. And I remember this gentleman came in, and I won't go into detail about what things looked like, but you can imagine they were very messy.
Bad.
It was really bad. And I just remember we took him to the operating room, we cleaned things up. We brought him back, I think, probably every second day for at least a week to do little reconstructions here and there. Wow. And then we did kind of a big reconstruction to do all the soft tissue once all of the bones had been plated together and stuff. And he was in the hospital for a while, but I remember when he was finally able to talk again, which, on its own was a miracle given the injury he'd had. One of the first things he said was, he was really happy he'd lived. He was really thankful to everybody that had done, whatever they could. And he totally regretted doing what he did. And, I hope he went on to live, a very full life. Unfortunately, I was a resident. So like you were, I was a very small cog in a big machine, and I have no idea what became of that gentleman in the end.
Yeah, no, that's That's amazing. I found that whenever I treated a suicide failure, they always regret it because they see the outpouring of love and grief from their family and friends, and they're like, "What was I doing?" You know, they were in a dark place, not thinking logically. But then you also had, you should share the really amazing story, because I think you presented that one in rounds, but you also had the famous shark bite in Canada, which when I first heard of it, I was
Yeah.
like, how the heck did someone get bit by a shark in Canada? There's no such thing. But you should share
Fish
that one,
market.
because that fish market. Because that's an pretty epic story that you were a part of.
Yeah, no, I was very lucky to be one of the residents on that case. I'm not going to pretend that I was the only resident on the case, because this patient was being treated for many, many months. So I, happened to be there towards the beginning of it, but I rotated out at the end and others came in. But this was a kind of big story. I don't know, I want to say like around 2012, 2013, where it was a nurse, actually. I don't know why this stuff always happens to nurses.
Because nurses are daredevils, man. They're like warriors. They save other people's lives, and then they're like, on their personal life, they're like extreme. Like I've seen, I have a lot of nurses on Facebook, and they're always doing like extreme vacationing, extreme sports. I think they're just like probably like doctors, a bit of like adrenaline, surgeons especially, adrenaline junkies, I think.
Yeah, rolling cars, jumping sharks.
Right? That was the nurse with the hand
Yeah.
transplant, right? Yeah.
Yeah. So yeah, she was down actually vacationing in Cancun, and went into the water, as many people do when they're on vacation in Cancun. And unfortunately, she made a new friend who was not so friendly. And
Did you know what kind of shark it was?
I don't think it was a great white. I think it was one of the lesser sharks that I don't really know the difference between. Not a hammerhead, because that one's kind of cool.
No, I wouldn't know either. I was just interested because now here in Boca, like I swim a lot, and I'm kind of learning about the different sharks, mostly because of fear of shark bites. But maybe it was a bull or a black tip. That's what I would guess.
Bull shark sounds very familiar now that you bring it up. So anyway, she, was bitten by this shark. I think the first bite went to her thigh, took out a very large piece of the thigh, and then the shark actually came back at her, and she tried to, I think, punch it in the nose or something along those lines. And
she's definitely a nurse. She's a fighter.
Yeah, totally.
It's amazing.
So it caught her arm, I think, while she was swinging, and it did some significant damage to her forearm. And she was initially treated in Mexico. And I mean, I don't want to disparage anyone. I'm sure everybody tried their best, but some interesting things were done there that we wouldn't necessarily do here. So the piece of her thigh actually washed back up on the beach. And a good Samaritan who was trying to be helpful, turned it over to the EMS, and they brought it to the hospital. I think it showed up an hour or two after her. I think we would have probably recognized this during our residency, that this is no longer viable tissue. It's been in, the ocean for a while, and then sitting on the beach in the sun. There is no good outcome from putting this back on someone. Definitely not placing it as a graft. We would want to hook up some blood supply. So they basically put this back on. Didn't actually look like they cleaned it, and just
I heard that was one of the details I remember. I remember there was sand in the wound.
Yeah, it was crazy. So she came back to Canada, I think it was like 5 days later, and first thing, straight into the operating room, like, let's clean these things up. This tissue was very much not alive, and as it started coming off, there was just like sand pouring out of it. And the arm was not in much better shape. Unfortunately, she did go on to lose the arm, but we were able to reconstruct the leg to the point that she was walking quite well. And I think the summer after this happened, so about 12 months, she actually went on a bike tour of Europe just to, kind of say like, F you to this shark. You can't take my leg. I'm going to bike all the way around Europe.
Oh, and that's a happy ending of what could have been a really horrible situation, but with plastic surgery, you guys were able to give her back not only her form, but also her function, which is an amazing story.
Yeah, it was a very memorable case. But you recently actually published a case that, you know, frankly, is somehow even more interesting.
Well, I think it's not like a one-upper because there's so many different amazing stories I'm sure we've been involved with. But this one was a doozy that I was involved with in residency, and it also made the news, and it also has been published. And then when I did publish, it kind of went viral. So, you know, I was getting interview requests from like CNN Latvia and like German,
Wow.
like Der Spiegel wanted to like reach out to me. But it was funny. They all wanted to talk to the patient because basically the story in a very shortened summary is a patient was minding their own business, which is always the case when someone is shot. They're not doing anything wrong. And she got shot on the left side of her chest, right over her heart. There's an entrance wound. It went through her breast implant, deflected a little bit off course from kind of where it was pointed across her chest, and then the bullet was lodged in her right, below her right implant on the right side. So when the trauma team called us and when we saw the x-rays, we're like, this doesn't make any sense. It was like JFK's magic bullet. Like, you don't know
Right.
how this happened. So, you know, we took out the implants, we took photos, we looked at the CT scans with some like ballistic experts. And the final conclusion was the only reasonable explanation is that the implant actually played a role in deflecting this bullet and saving this young lady's life. So it was like CSI Toronto. And
Amazing.
then, yeah, and it was an awesome story. And the funny thing was, so I kind of claim that all these newspapers were wanting interview requests. It's only a half truth. The full truth is they wanted to talk to the patient. They were just like, hey, that's a great story. Can we talk to this patient? And I'm like, listen, she, after getting shot with the bullet, disappeared. She, you know, we didn't even do follow-up care.
Wow.
She just kind of went MIA. And which maybe you can understand if someone shot you, maybe she didn't want to be found by these individuals. So
Yeah.
that was that.
And I mean, even if she was around because of confidentiality, it's not like you could have told them who she was anyways.
No, exactly. So, you know, that's a good point is that, you know, all the stories we're talking about, you know, the patient has to give permission to talk about it, but they never, ever really give permission for their name to be used. You can't use the name. But that's interesting about the hand transplant. She actually was on the front page of the Toronto Star because the hand transplant was a nurse and she wanted to be the face of this kind of new surgical program that they were developing at the Toronto Western. But yeah, the bullet implant lady just disappeared.
Wow. So I got two questions about that for you that I kind of been wondering since I heard about
go
this
ahead.
case. So do you think that it was like the patch on the back? For those of you who don't know what an implant looks like, it's like a big circle of silicone, but at the very back of it, there's kind of this little circle that's harder where it closes off the hole that they fill it from. So do you think that that is sort of what it ricocheted off?
So we actually, when we took out the implant and in the paper, there's a nice photo where we take a steel rod and you can follow through the implant. You can see there's like little dirt and debris through the implant, and it didn't hit the, I know what you're talking about. And it didn't hit that tougher area. It actually went obliquely through the implant and just through the regular parts of the shell. What I really think, and this is what the ballistic experts think, is that the bullet, when the person went up and shot, it was very close range. The bullet was already at a weird angle. Like it wasn't, even though the bullet hole looked like it was straight, probably the gun was at a bit of an angle. And the implant, it's like when anything hits a different medium, like, you know, when you hit water or you hit gel, it has a little bit of an effect. It's going to change the trajectory just a little bit. And the gel, just by a factor of maybe a degree or a half a degree, was able to deflect the bullet enough that it went off the sternum. And the funniest thing, or I'd say the funny, most interesting thing is you'd think, okay, well, where was her rib fractures? Because maybe the implant didn't do anything. It was the ribs that it bounced off. So the only one rib fracture she had was on the right side where the bullet landed. So it didn't actually hit any bones on the side where the bullet entrance was. So that's why the conclusion is, I mean, you'll never know unless you actually do an experiment where you create the exact same conditions, but just like best guess with the CT scans and with the evidence that we have is that the implant, whether it was 1 degree or half a degree, saved this woman's life.
That's amazing.
Yeah.
And
I mean,
now
I wanted to do the experiments. Imagine you get the funding. You're like, okay, so let's get a bunch of implants. We'll get a bunch of handguns, and we get to fire them through implants. And there was one study where these guys did it through silicone to see what the kind of bullet stopping properties of a silicone implant is. And they're not good. It doesn't stop bullets, but it does have an influence on their trajectory.
Interesting.
Yeah.
And now you're kind of like ideally positioned to do that experiment. A plastic surgeon in America, you have unlimited access to breast implants and guns.
Well, people came out with some good comments, like exactly like yours. Like they're like, what do you think like a bulletproof coated implant would sell? Like maybe you could sell it to the US military, or you could do these things. And I'm like, well, I don't know. It seems like a lot when you could just put a vest over your chest. But yeah. And the other surprising thing is with the amount of guns and with the amount of implants around the world, but especially in the United States, you think this would be more common, but there's actually only 4 or 5 cases in the literature where an implant has been hit by the bullet and the woman survived, and this is the only one where it was a definitely evidence that it was the implant that saved her. The other cases, it was kind of like incidental.
Wow.
Yeah.
And did the implant company cover replacements under the rupture warranty for that?
That's a good question. I'm pretty sure they did. Remember, I was a resident in my final year, so I didn't deal with those questions, but I'm pretty sure they would have replaced that implant for that reconstructive case. Oh, and that's the other thing. We didn't put an implant back in because remember, it was kind of like an infected traumatic field.
Yeah.
So we just removed the implant and we offered her, if she wants a reconstruction, just wait till there's no signs of infection, a couple of months, we'll see how you're doing. And she disappeared.
Interesting.
Yeah.
One thing that I've noticed, like I treated a few gunshot wounds when I was a resident. I'm sure you've seen other gunshot wounds as well. When you mentioned that the trajectory was kind of wonky to begin with, like one thing that I noticed in Toronto is honestly, people are horrible shots. Like I've seen cases where like somebody should not survive. Like I remember this one guy who came in, again to the trauma center. He had been shot 10 times. And I think it was like from 3 or 4 feet away by multiple guns at the same time. And everything like glanced off him. There were no actual injuries. I think the only one that was like a real wound was like one went through the palm of his hand. So we like sutured it, but it missed the bones, it missed the muscles, it missed the arteries, missed the tendons, and literally just went right through. He was barely bleeding and he got sent home the same day.
But I think caliber of weapon has a lot to do with it because, definitely this woman it was probably a low caliber handgun, like almost 1 grade above a BB gun, that kind of deal. And so maybe your guy too, like, the power of the weapon has a big difference. And I think here in the US, people use like those powerful semi-automatic weapons. And I think in Canada, a lot, they're usually smuggled smaller guns. This is just me, playing CSI Toronto with my gun knowledge now. So I think that guy just got either extremely lucky or more likely they were just using kind of very crappy handguns. They weren't using the Clint Eastwood like magnums,
That's right.
It's not like blowing a hole in the door like this. Yeah, no, not those ones.
You always go hunting with a howitzer.
That's it. So I don't know. I think this was a pretty good intro because I feel like this was a good intro. I think the podcast to come, if you guys are interested, we're going to really focus on specific procedures, the differences between, Canada and the US, and the differences, I think, between us as newer school, younger plastic surgeons versus maybe the older school plastic surgeons, and also non-plastic surgeons that are trying to kind of be the hucksters.
I cannot wait to talk to you about psychiatrists doing liposuction in Florida.
No,
but we'll save that for another episode.
We definitely have to save that one.
Yeah, this let's end on a high note, as George Costanza says, and we will talk to you all at the next episode.
All right.